Hello, today we are presenting food insecurity along USA and the Mexico border. Why is food insecurity important and why should it be studied? The food insecurity affects millions of people in both sides of the border. The regions experience unique structural challenges and regional disparities. Our goal is to compare food insecurity between Mexico and the US border to see which are these differences and challenges. We want to identify predictors of food insecurity along Mexico and the USA.
This map shows the bordered counties of counties that are more than 10 miles away from grocery stores. And as you can see on the border, that there are very high concentrated counties that have few access to grocery stores. And this definitely plays an impact on food insecurity. And Texas has the highest concentration with the dark, because the darkest states. And
This interactive map of the Mexican border states helps us understand how socioeconomic conditions shape food insecurity. Even though these states have a high economic activity and strong connections with the US, the map shows large internal differences. For example, in Baja California and Nuevo León appear to be more developed overall, but when you explore the map, you still find pockets of vulnerability communities. States like Chihuahua and Sonora show a mix of socioeconomic levels, especially in rural areas, which lead to uneven access to food and services. Meanwhile, Coahuila and Tamaulipas fall into medium socioeconomic levels, with instability and clear gaps in how services are distributed. This connects directly to the US map we saw earlier on the US side. Barriers are more physical, like long distances to grocery stores, while in Mexico, barriers are more socioeconomic. Together, both maps show that the border isn't just dividing a line, it's a region where structural challenges stack up on both sides.
This graph shows the relationship between the percentage of those living beneath the poverty line in a county and the percentage of those with low access to grocery stores at a 10-mile radius. In the blue, we see our non border county data, where, yes, there is slightly a positive correlation to having a high percentage of those in poverty and having a high percentage of those who have low access to grocery stores. But when we're looking at the border county data in the red, we can see that as the percent of poverty in each county increases, the likelihood that they will have low access to a grocery store increases by even more, showing that there is a steeper relationship between poverty and not having access to food in border counties than there are in non border counties.
When we look at the state by state food insecurity indicators in the Mexican border states, we see a clear pattern. The most severe experiences, like skipping meals, running out of food, or worrying out when the food would run out, are extremely common, especially in states like Chihuahua and Tamaulipas. Even the more economically developed states, like Baja California and Nuevo León, still show hundreds of people reporting serious hardship. Now, when we compare this to the US graph on the left, where higher poverty rates are strongly associated with limited grocery access, we start to see a shared story across the border. In both countries, structural disadvantages pile up. In the US, it's poverty combined with physical distance from stores. In Mexico, it's economic strain reflected through living experiences of food scarcity or insecurity. Together, these visuals show that whether it's lack of income, lack of access, or both, border regions on each side face overlapping vulnerabilities that make households more likely to experience food insecurity.
This graph shows the average percent of residents living beneath the poverty line compared to the average percent of residents that do not have health insurance in each county, separated by if it's a border county or not. As we can see, where in the non border counties, the level of uninsured people is lower than their poverty percentage, meaning that even if you don't have socioeconomic means, you typically are able to sometimes find health insurance. However, we can see that in border counties, the uninsured percentage is actually higher than the poverty percentage on an average basis. And this means that in addition to not having the means to provide daily necessities like food, home, water, clothing. They also may not be able to provide health insurance and may not be getting the same kind of nutritional care that those who live away from the border are.
Here we can see how lack of access to health services varies across Mexican border states. Baja California stands out by a large margin, with far more residents unable to access basic healthcare compared to the rest of the states. The other states like Chihuahua, Nuevo León, Sonora, Tamaulipas, and Coahuila show smaller but meaningful gaps. This pattern matters because when people can access health services, their vulnerability to food insecurity increases even more. Without healthcare, families have fewer resources, higher expenses, and poorer nutritional outcomes. This connects directly to the US graph, showing that higher poverty rates in border counties are linked to limited access to grocery stores. On both sides of the border, we see the same dynamic: structural disadvantages, whether poverty, lack of services, or long travel distances, translate into reduced access to essential needs like food and healthcare. Together, this graph shows that border communities in both countries face overlapping pressures that make them more susceptible to food insecurity.
So, to wrap up our project, our comparison really showed that food insecurity is a challenge on both sides of the US and Mexican border, but very different for a lot of different reasons. In the United States, the issue tends to come from more like factors like poverty and the long distance that many communities have to travel to reach a grocery store. But in contrast, Mexico, food insecurity is more closely linked to the broader inequality and limited access to basic services such as healthcare. So, what stood out to us is how these patterns reflect each country's structural realities. And it reinforces that solutions can't be a one size fits all for border states in both countries. They have to be tailored to local conditions and created through cooperation between different regions. Working on this comparison in a global classroom made the analysis even more meaningful because we were able to bring together a perspective from both sides of the border. So that helped us build a fuller understanding of the problem and think more critically about what effective solutions might look like. Thank you so much for taking the time to learn about food insecurity along with us. And if you have any questions, feel free to email.